healing environment for patients is the utmost important goal as a nurse. During this time of stress, patients rely on their families for support and also decision making. Studies have shown that family-centered care provides for positive outcomes in a healing environment. As a nurse advocate, we can include the family and patient in their plan of care and incorporate them into the bedside shift report process. When the report is given at the bedside with the patient and family, the nurses are able to receive information from the patient and family as they provide an additional resource for diagnosis and treatment. Patient and family participation may prompt recall events and issues and clarify misinformation that is shared during report. There is an opportunity to acknowledge and act on patient or family observations. When nurses speak with the patient and the family, they are given an opportunity to incorporate their observations and desires into the plan of care. A family-centered care model formalizes each patient and the patient's family as a unit of care. Family-centered care comprises three concepts: respect, collaboration, and support. Patient and family members witness staff communication, professionalism, and organization as responsibilities transition to another nurse. Patients also feel a part of report and appreciate having input. Welcoming the participation of patients and families offers them an opportunity to participate in the exchange of information. This will ensure that the staff, patient, and family all have knowledge of the treatment plan. Patients and families like and need to know the plan of care to be able to contribute to decision-making and planning.
Focused care has been part of nursing since the 1970s. Recognition of the important role that patients' families play in providing support, assistance, and care for the adult critical care patients is much more recent. Family-centered care is defined as an innovative approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare patients, families, and providers. To provide holistic care, critical care nurses must involve families in patient care, and by doing so, better meet the needs of the families and patients. Any illness severe enough to necessitate admission to a critical care unit is life-threatening and can precipitate severe anxiety within a family system. Fear of death, uncertain outcome, emotional turmoil, financial concerns, and unfamiliar hospital environments are a few of the sources of anxiety for family members. Specialized assessment and intervention for families are needed because anxiety may interfere with the family's ability to receive and comprehend information, maintain patterns of adequate functioning, use effective coping skills, and provide support for each other and the patient. The American Association of Critical Care Nurses offer interventions from research-based protocols on family needs and interventions in the acute care environment. Some of these interventions are to identify a family spokesperson and support persons, identify a primary contact for the family to assist the family in understanding the patient's condition, establish a mechanism for family access to the patient, such as open visitation hours, promote access to the patient and ensure staff consistency in adhering to unit policies, provide information based on family needs, ensure support services are available, explain all procedures using understandable terms, offer an ICU tour, which reduces anxiety resulting from the environment, and include the family in providing direct care, such as in assisting in performing activities of daily living. The focus of nursing interventions is to maintain the present level of family functioning, prevent further psychological or physical deterioration, and educate families so that normal adaptation to the health crisis can be fostered. The family remains the most important social context to consider when determining interventions to positively influence the patient outcomes.
Patient and family-centered care is an approach to the planning, delivery, and evaluation of healthcare that is grounded in mutually beneficial partnerships among healthcare providers, patients, and families. It redefines the relationships in healthcare. The core competencies of patient and family-centered care, as developed by the Institute for Patient and Family-Centered Care, are respect and dignity. Patient and family perspectives and choices are respected and honored. Their knowledge, values, beliefs, and cultural backgrounds are incorporated into the plan of care. Information sharing. Health information is shared with patients and families in order for them to effectively participate in care and decision making. Participation. Patient and families are encouraged and supported in participating in care and decision making. Collaboration. Healthcare leaders collaborate with patients and families in policy and program development, implementation, and evaluation.